Good morning. This is Terry Kuti with Deep Sea Foundation. I'd like to welcome you to our educational video channel where we discuss various topics about breast cancer and breast reconstruction. I'm very pleased to have a special guest this morning. Her name is Leona Bell. I want to give the viewers just a little bit of background how we met. Leona was the oncologist that I had. Has it been 10 years ago, Leona?
I think so, probably.
Yeah. When I transitioned from Texas to Arizona, I wanted to find an oncologist just for follow-up because it was after my first diagnosis, and I wanted to make sure I was getting all my tests done and follow-ups. So I found Leona. Well, I didn't know that in 2014, I would be coming back to you really after a shocking second diagnosis to get some counsel from you, second opinion. But things evolved for you shortly afterwards. So that's how they did. That's how we got to know each other. And because of your training, your medical training, because of your current interest, and because you're a survivor, you are the perfect trifecta to talk to our viewers today. I'm going to let you take over and tell us your story. I'm so happy to have you. It's so good to see you.
Oh, thank you, Terry. It's so great to see you. And I'm so happy to be able to keep up with you through your foundation and everything. I love being able to follow you and all the stuff that you've been doing since, we knew each other in a different sort of environment.
I know. Who knew? Life takes us in directions, and I want to hear, I want you to tell the viewers about your story. It's a pretty amazing.
All right. Yeah, it sure is an interesting and sort of ironic story. So, as Terry mentioned, I was a medical oncologist who specialized in the treatment of breast cancer, and I did that for about 10 years or so in Tucson, Arizona, first working at the University of Arizona there, and then in private practice. And I loved that work. I loved interacting with people and helping them get through, what really can be the craziest experience. Going through breast cancer is life-threatening. It's so scary, and I really loved doing the work. But in 2015, I decided that I needed to do something different for myself. I wanted a little slower pace of life, sort of a change in my own situation. So I retired, and people laugh and say, "How old are you?" So I retired a little bit early, and my husband and I moved to Puerto Vallarta, Mexico. So sort of seeking a healthier lifestyle, a little slower pace of life, seeking really more time for things that I thought were good for me, like yoga primarily, healthy eating and stuff like that. So I get down to Mexico and I'm feeling really relaxed and healthy and, having more time to take care of myself. And in the most ironic turn of events, just about a year after I moved down here, I was diagnosed with an aggressive breast cancer myself. And it's sort of a crazy story. I sort of ignored the lump for a while because I had a benign mass in my breast in that same area. And so it started growing, and I just thought, it's just that fibroadenoma. There's no possible way I could get breast cancer after having sort of had the career that I had. But as life has it, of course, it turned out to be a breast cancer. And so I was diagnosed with a stage 3A HER2 positive breast cancer just about 4 years ago this month. So I had chemotherapy, I had a bilateral mastectomy and implant reconstruction, and I had radiation to the chest wall because the size of the mass was large and I had some positive nodes at diagnosis. So I had been a yoga practitioner for some years before that, even going back to when I was working in Tucson, and I fell in love with yoga because it helped me in so many ways. It helped my mind, it helped my body. I had like some chronic back pain and stuff, probably from sitting in chairs and, being stressed out or whatever. But so I fell in love with yoga some years before I moved down here. But then it was during my cancer treatment that I really realized how profound the benefits of yoga could be for cancer survivors. And it was during that time when I was sick and I was using what I had learned about yoga. It was during that time that I realized I need to become a yoga teacher so that I can share this with other people who are going through a cancer experience. So once I got better, the following year I did a yoga teacher training here in Puerto Vallarta. And then basically since then, I've just been kind of building on yoga teaching for cancer survivors. I focus mainly on breast cancer survivors just because that's my professional expertise and my personal expertise. But I have, you know, a handful of people that I've been teaching who have other types of cancer as well. So, you know, it was going through it myself where I really realized how deeply the yoga practice helped my mind, you know, helped me ease fear and anxiety and stress and all those things that you go through, you know, even still 4 years later. And then the benefits to my body were unbelievable. You know, I had a lot of fibrosis from radiation and limitation in my range of motion that were painful and sort of frustrating at first. And yoga's really helped me to where I feel like I'm stronger and healthier than I ever was before. So here I am, and I'm hoping to share those benefits with anybody who's interested in partaking.
You know, I'm not surprised you went down this path, really, even though I know that in your oncology practice, that can be that can have such stress on a person to have a medical profession. There's so many, but you know, there's a lot of professions that bring on stress.
Right. And just our modern lifestyle.
Yes. But I have to tell you, I remember sitting in your office, always feeling a sense of calm and peace. So this does not surprise me, Leona, that you've gone down this path and taken on this new interest. It's not a new interest, but develop this interest. And now, what a gift! What a gift to pay it back to your fellow survivors. You know,
right?
Your survivor. So it's really great.
Thank you.
Oh gosh, thank you for what you're doing and giving back. I see Kitty in the background. Namaste.
Yeah.
You know, you brought up some good points. We've both had reconstruction. You had implant reconstruction. I had deep flap. I also had radiation on my left side, my first diagnosis. And so fibrosis, scarring, range of motion. I was told by my plastic surgeon after my reconstruction that one of the best ways to get your balance back was to begin doing gentle yoga. Now, I want to preclude this by saying, you know, I don't want anyone to think they can start it at any time. So you might want to address that too.
Right.
Tell us about that benefit after reconstruction, since we both had reconstruction, we both have radiation.
Yeah. So, you know, there are so many complicated things that go on in our bodies with surgery and radiation and reconstruction that it can be really complicated and have a lot of effects on the chest and the shoulders, the low belly, really just a lot of our bodies. And so, you know, for the audience, for the viewers, anybody who's been through it, you know, anytime we have surgery on the front side of our body's natural response to scar tissue is to sort of contract. And so many times we end up with this sort of rolled forward shoulders and this abnormal posture, maybe a little asymmetry, you know, one side's different than the other. You can have a lot of stuff that happens to your shoulder. And so most of us who've been through breast cancer treatment end up with some pain, some limited range of motion. And the great thing about yoga is because it's such a whole body sort of practice, it can help all of those things. Of course, as Terry mentioned, one of my biggest things about yoga is that you have to be careful. You have to start slow and just increase your practice very gently so that you do it safely. And that's a big part of what I'm wanting to teach people is how do you go about starting a yoga practice safely? I think people are sometimes intimidated and afraid, you know, I might hurt my reconstruction or I might hurt my port or whatever they have going on. And so I think you have to do it safely, but you can. And one of the things that's really important to me is to not think, okay, because I've had breast cancer or because I've had these surgeries, that I can't get back to a super full and active life. I sort of hate the idea that like, oh, well, I'm limited now and I can't do this or I can't do that. I never wanted to believe that, and I never wanted my patients to feel that way. So I think yoga is an amazing way to safely increase your activity, to be able to, you know, get to the point where you can do anything. As strong as you want to be, you can get there. So that comes back to kind of how do you do that safely?
Yeah.
So most people will get a little bit of instruction from their surgeon, you know, and in the first week or so after surgery, you've got drains and incisions, and they don't want you to be doing a ton of activity. But most surgeons will say, you know, basic gentle movement like you would do for self-care, brushing your hair, or gentle movements that are just going to move your chest very slightly. I think that's about what you want to do the first week or so while your drains and incisions are still fresh. If you do too much work right at the beginning, you get more fluid buildup and you can end up with seromas and your drains take too long to come out. So very cautious the first week or two. And then once the drains come out and the incisions are starting to be healed, then usually your surgeon will start to tell you, okay, these are the activities that you can start to do. And that's the time, really pretty early in your recovery, that you could start with some gentle stretching movements, you know, starting to not let your shoulders be rolled forward and not letting that chest get so contracted. So just starting with some of the very gentle, simple movements we do in yoga can make a huge difference in how much that scar tissue builds up and how much limitation you develop.
Yeah.
And then the next sort of time point is, and I always tell this story, I love my breast surgeon, but she knew I was a yogi, and she said, you are not to do downward facing dog for at least 8 weeks after my surgery, because she knew I was going to be itching to want to get back to practice. So there are certainly some things that are more vigorous sort of effort, like weight into your arms, like planks and that sort of thing, that you really need to wait a little while for.
I do remember after my reconstruction, so my surgeon knew that I did planks too, and I would him and I go, can I do a plank yet? He goes, don't you dare. And it was about the 6 to 8 weeks, you know. Then I ask him again. He goes, start slow. But you know, Leona, you what you're talking about, this is something I was thinking about this morning before we got on the air here. You know, as a breast cancer patient, I think we have to learn to trust our bodies again. And what you say about this gradual getting back into this activity is part of that, because it's like your body almost betrayed you when you had breast cancer. And you go through all those emotional gymnastics, and it's like, why did this happen to me? You know, am I going to be the person I was before? Well, maybe not, but look at you. You're a new, better person. And so, yeah, so that's really encouraging to let people know that it's a slow progression, but you can do it. And
100%.
Yeah, to learn to trust your body again. I think that's so important.
Yeah, that's a big part of sort of what I talk about in my yoga teaching for cancer survivors is, okay, we as teachers can give you advice and encourage you in certain directions on how we think things should be, but you really do need to learn to feel your own body. You know, you have to learn to feel what's going on inside your body, and not do just what the pose looks like on a picture, because it might be different for you, you know, based on whatever kind of scar tissue you've got. You know, we're all different in the way we heal. And so it is a huge part of yoga, learning, you know, when you can push a little more and when you need to back off, and being okay with that either way. So you can get real hard on yourself and be like, I'm so frustrated that I'm not getting strong enough, quick enough. And we've got to really learn to be patient with ourselves and be gentle with ourselves so that we heal and we build the strength in the safest way possible. Because if you push too far and then you hurt yourself, well, then you've taken 2 steps back. So it's one of the things I love about yoga is, you're getting the benefit wherever you're working that particular day. I have days where I feel really strong and I feel like I can push myself. And I have days where, my shoulder's a little achy or something and I need to back off. And man, it's a great lesson, not only for your yoga practice, but for life, right?
Yes, it is. So you bring up a good point. You have I'm going to have the information at the end of this video today, but you started a great online Facebook page. Can you tell us about that a little bit? It's going to be a great resource that we can share. I'm excited about it.
Absolutely. So when I first started teaching yoga for breast cancer survivors, I did a couple of in-person retreats down here in Mexico. And I thought, it'll be beautiful and people can come down. And they were lovely. They were really amazing. But what I realized after a few of those retreats is that's such a small number of people that I can reach and that I can help. And I thought, gosh, I just have to go online so that I can reach everybody, people that can't go to Mexico because they have kids or work or life, so exactly. Or right. Coronavirus. So a year and a half ago, maybe I started working on a website and then a Facebook page. And so it's called Yoga with Leona. So you can just search it on Facebook, Yoga with Leona. And I love my Facebook page because it's free to everyone. So anyone can look at it. I share really great stuff from other people around the internet. So there are other people who, like, for example, this wonderful physical therapist who does physical therapy for cancer survivors. I share stuff from her. I share articles about, the benefits of exercise in cancer survivors, or, just different things about that I think are important to me as a breast cancer survivor, who wants to be healthy and fit. And then, I've started sharing also little bits, little videos and things, certain stretches that I love. I posted one recently. I said, this is my favorite shoulder stretch because I still have all this tightness, right? So my Facebook page is there for anyone to check out. And then I also built a website where I actually have posted a bunch of sort of fuller length, really in-depth videos about yoga and breast cancer and the intersection of those two, and how it can really help us. So the website has not only yoga practices, so like full-length hour-long yoga practices that are specially designed for breast cancer survivors, but also informational, or what I call educational videos, where I talk about yoga philosophy and how that's a whole nother part of what we can learn from yoga. Other things like meditation and breathing practices that, are also huge in helping us really heal and get through this. So I know Terry's going to post the website at the end of the video, but it's also just yogawithleona.com. So if you want to check it out, you can have a look.
Listen, I'll tell you. So you are on our closed Facebook group. So for the viewers, we that's part of what the foundation does is support other women and men going through breast cancer. So here's a story on that. The other day, I posted one of your videos, Leona, and it's so cool how this circle of education works. So here's what happened. We had a viewer who hasn't had a reconstruction yet. I'm going to read what she said. It was such kind of a beautiful testimony to what you're doing, but how the work you're doing can impact all of these women and men around the globe on the Facebook page. Let me read it for you, okay? Because she kind of had a little bit of a question. So she says, if I may, I'd love to know what modifications we should be aware of, specific to post-mastectomy recon procedures. I'm 9 weeks out from a single mastectomy and happy to report, I love this comment, I have 95%-ish mobility. Saluting sun. That's a yoga move. You can talk about that in a minute. am trying to visualize what it may look like after deep when that happens. What a forward-thinking comment. She's already found the benefits of yoga. She looked at your video that I posted. Can you address that for her? Because she said, can you talk to Leona about this when you interview her? So.
Yeah, what an amazing person this particular person is, to be thinking about it ahead of time so that you're preparing yourself for what you're going to go through. I mean, I wish we could all have the foresight to do that, you know. But yeah, so, you know, there are certain modifications that we can take in yoga postures. So a lot of women would say, well, I can't, you know, put my arms all the way above my head because of this tightness or this scar tissue that I've got going on. And so that's part of the whole point of what I want to share with people is, yes, that may be true, but there are modifications. You know, you just change the shape of the posture slightly such that it feels okay to your body, such that you don't have, you know, pain when you try to stretch your arms in a certain position. So it's actually really pretty simple. Most of the postures we do, so for example, if you stretch your arms all the way out to the sides, you can notice that that feels kind of tight across the front of your chest. And remember back to when you just had radiation or just had surgery, the simple thing that you can do is you just bring the arms forward slightly. So your arms come sort of into a V shape in front of you. You can see how that just eases up the tightness across your pecs. Very simple.
I already feels more relaxed just doing it with you right there.
Right. So then eventually over time, you know, you're slowly moving back. And as you build the flexibility, then you can get into the full posture. Same thing with arms above the head. So a lot of yoga postures, we have arms all the way up, and this is really uncomfortable for people's shoulders if they've had a lot of surgery. So very simple, you bring the arms into a cactus. So then you can do the whole practice. You just have these slight modifications as long as you need them. And then ever so slightly over a few weeks' time, you're slowly moving your arms back. If you go, oh, it's still a little uncomfortable, you take them back down. So it's really, it goes back to what you said about listening to your own body and knowing what feels okay to you and what feels like too much of a stretch. The other important thing I think about addressing our question is just knowing what we kind of mentioned earlier about there is a period of time where you need to avoid the super really vigorous stuff. So for example, often in sun salutations, we end up going through a plank position or through downward facing dog where we're putting a lot of weight into our arms. And probably most surgeons are going to say you shouldn't do that for about 8 weeks or so. But at that point, then you start to slowly do it again. So what I do in some of my videos is I have a sun salutation that I do on my knees, and it goes through a very brief downward facing dog. You're in downward facing dog just for one breath, and then you're back to your knees. So if you just very slowly and gently reintroduce those more vigorous postures, then you allow your body to get used to it and build the strength and flexibility so that you can do it safely.
Well, I'm motivated. I kind of want to go watch videos this morning.
I get it.
You know, I had deep flaps, so I have the big abdominal scar, and many of the women on the Facebook group have. One of my favorite things to do in the morning, though, I do a daily plank, and then I do a child's pose. My hip flexors, oh my gosh, they're so great, Leona. So
it feels delicious, doesn't it?
Oh, it is. It's delicious. It is delicious.
I love it. I love child's pose. And so child's pose, I offer that instead of downward facing dog. If you're not ready to be putting weight into your arms yet, you can still do a whole yoga practice. You just do child's pose instead of down dog until your arms are ready to do it. You know, so you're right. You just find the postures that work for you, that feel good to you. You mentioned, and I want to address this briefly, you mentioned the tight lower abdominal incision for deep flap women. And I mentioned to Terry earlier, I have 2 followers who've asked me to do a tutorial on that because it is such a challenge, you know. So as I was mentioning with the chest, anytime you've got a big scar, it's common for your body to sort of contract in the area of the scar. And so many women will feel this sort of pulling forward or contraction the front side of your belly. So it affects your posture even. And so I think it is important to, once that incision is completely healed and once your plastic surgeon says it's okay, to start stretching that area, you know, and like I said, always start slow, be gentle, But we can, over time, stretch that area such that you won't have that tight, uncomfortable feeling, and you won't have that effect on your posture. So I'm going to make a tutorial video about a few different stretches that'll be great for the low abdomen, and I'm going to share it with Terry so she can share it with all of you guys.
I am stoked. I think, Leona, other than saying a huge thank you, and for the viewers, please, comment on this video today. Throw us out some questions or comments and let us know if you have any other questions, and I will forward the comments to Leona and let her know. But also, if there's any other topics that you want us to cover, we may have to revisit this, Leona, and do another video.
Yeah, I think we could probably do another session. I could talk about the science behind yoga and breast cancer, which I love.
We're gonna get our phones out and put that on the schedule when we're done.
All right, sounds good. I do want to mention, just as Terry said, please write in, if you have something, a question, or you say, gosh, I'm working on this thing and I'm having a hard time. That's what I'm here for. So I want to just help everybody. And it might be something as simple as me giving you a little brief video or tutorial on how to do that with your arms, so it'll be different.
Maybe we could make a video for the foundation channel.
I would love it. Yeah, absolutely. Would love it.
Well, if you have any other topics you want us to cover, please let us know. Again, Leona, thank you so much for being on the Deep Sea Foundation channel today.
Thank you, Terry.
There's only one way to end this.
Namaste. Thank you, Terry.
Thank you so much.